Welcome back to Parasitology. Hi, I'm Christopher. Today we are finishing this ectoparasite set with a group that is small, strange, clinically important, and sometimes deeply committed to causing chaos: the mites and the misfits. We will cover chiggers, mange mites, poultry mites, snake mites, bed bugs, sheepheads, and a few arthropod-adjacent oddballs. The goal is not to memorize every tiny leg, claw, spine, and microscopic bad attitude. The goal is pattern recognition. By the end, I want you to be able to ask a series of questions. Who is the host? Where's the lesion? How does the parasite live? And what diagnostic method matches that pattern? That framework keeps mites from becoming a tiny dermatology tornado. When you suspect mites, slow down and ask 3 questions. First, who is the host? A dog, cat, rabbit, bird, snake, sheep, or cow? All push your differential in different directions. Second, where is the lesion? Ear canal, skin surface, hair follicles, feet, feather, legs, or skin folds, or the environment? Site matters because most mites are not wandering around randomly. They have favorite neighborhoods. Some are ear people. Some are follicle people. Some are focused on feet, which is oddly specific, but medically useful. Third, how do we collect it? Ear swab, tape prep, flea comb, superficial scrape, deep scrape, trichogram, or environmental sampling. The collection method is not an afterthought, it is part of the diagnosis. Before we enter the clinical list, here's the map. Don't turn this into a taxonomy panic attack. It's not as bad as it seems. Many veterinary mites fit into 3 broad traditional groupings, and their name tells us where or whether their breathing openings are found. The Greek word stigma means a mark or puncture made by a pointed instrument. It is the same word behind the religious stigmata, and yes, the horror movie. In acrorology, a stigma is simply a spiracle or breathing opening. Meso means middle. Mesostigmata have spiracles along the middle sides of their body, commonly around the 3rd or 4th coxae. Think dermonissus, ornithonissus, and ophionissus, poultry and reptile mites for which the housing and environment may matter. A means without. Astigmata lack external spiracles and exchange gases across the body surface. Think Sarcoptes, Notoedres, Sauroptes, Odidectes, and Nemidocoptes. Mange, ear, crust, and scaly legs. Pro means front. In prostigmata, the respiratory openings, when visible, are towards the front near the mouth parts. Think Demodex, Chilatiella, and chiggers. Follicles, walking dandruff, and the red larva. So remember, middle, missing, front. Use that pattern to organize the clinical mite groups that follow. Mites make more sense when grouped by lifestyle. Surface mites live on the skin, hair, feather, scale, or crust. Burrowing mites tunnel within the superficial skin. Follicular mites live down in the hair follicles or sebaceous units. Ear mites specialize in the ear canal. And blood-feeding mites may spend time on the host, off the host, or in both places. And then there are chiggers. Chiggers are the larval stage of trombiculid mites. Only the larva is parasitic. The adult is not sitting around plotting revenge on your ankles. The larva is the clinical stage you find on the patient. So our rule is already working. Lifestyle predicts site, and site predicts the diagnostic method. Otodectes cyanotus is the classic ear mite pattern. Its name nearly gives away the case. Oto means ear, dectes means biter, and cyanotus refers to the dog ear. Put it together, it essentially means the ear biter of the dog ear. The name reflects its history and can be misleading today. Heyring originally described the mite from the canine ear mange in 1838, although today it is encountered most characteristically with cats, especially young cats. Dogs, ferrets, foxes, and other carnivores may occasionally be affected. The site is the external ear canal. Look for pruritus, head shaking, otitis externa, and dark ceruminous debris. The classic coffee ground appearance should raise suspicion, but debris alone does not confirm the diagnosis. This is a surface-dwelling mite, rather than a follicular mite or a deep burrower. Go directly to the ear with otoscopy, an ear swab, and a mineral oil preparation. The mites may sometimes extend to other areas of the skin, but the ear canal remains their signature site. The pattern is ear canal plus dark debris plus contagious pruritus, and most commonly in a cat. It is a satisfying diagnosis when you find the mite, but remember that otitis has many possible causes. Clinical appearance guides the search. Identification of the mite and/or eggs completes it. Sarcoptes scabiei is the classic burrowing mite pattern, and its name is unpleasantly accurate. Sarco means flesh, tes means cutter, and scabiei comes from the Latin word meaning to scratch. In other words, it's the flesh cutter that makes you scratch. In dogs, think intense pruritus, especially around the ear margins, elbows, hocks, and ventrum, following by papules, crusts, alopecia, and sometimes the pinna-pedal reflex. The key phrase is intense itch. The severity reflects not only the burrows, but the host's hypersensitivity response. So a dog can be extraordinarily itchy even when very few mites are present. If parasites had theme music, Sarcoptes would enter with frantic scratching, dramatic lighting, and complaints from everyone in the household. Exposure can produce transient pruritic papules in people, which makes the household history clinically useful. Diagnosis involves broad skin scrapings from multiple, preferably non-excoriated sites, collecting the superficial epidermis. False negatives are common, so a negative scraping does not exclude sarcoptic mange. Absence of evidence is not evidence of absence. Combine microscopy with lesion distribution, exposure history, clinical suspicion, and the response to appropriate treatment. Microscopically, look for a rounded body, short legs, dorsal scales, and in the adult female, long unsegmented pedicels with suckers on the first two pairs of legs. The parasite is tiny, but the itch is very large. Notoedres cati is the feline counterpart to Sarcoptes. It is another burrowing mite, but the host and lesion distribution provide the pattern. Think cat, intense pruritus, and thick crusting that commonly begins along the ear margins, face, and head. In severe cases, lesions may extend down the neck, involve the feet or limbs, and eventually become generalized. The name gives us a useful microscopic clue. Notoedres comes from the roots meaning approximately back and seat, while cati means of the cat. It is essentially the cat mite with its seat on the back, referring to the dorsally positioned anus. Taxonomy has quite literally put the anus right in the name. The diagnostic pattern is cat plus crusted head lesions plus intense pruritus plus superficial skin scraping. Notoedres mites are often more numerous and may be easier to recover than Sarcoptes, but sampling an active crusted margin still improves your chances. Microscopically, compare the anus position. Sarcoptes has a terminal or posterior anus, while Notoedres has a dorsal anus. This may not be the first detail discussed during client discharge, but it is an extremely helpful distinction under the microscope. Although uncommon in North America, notoedric mange can be severe and highly contagious among cats. It may also cause transient pruritic lesions in exposed people, so recognition matters for both the patient and the household. Now we move from burrows to follicles. Demodex mites are elongated cigar-shaped or worm-like mites associated with the pilosebaceous unit. The classic canine species is Demodex canis, while Demodex ingi has a much longer body. Dogs may also carry short-bodied, more superficially located cornea-like mites. Their relative body length and location help you recognize what you are seeing. Demodex canis is the most common cause of canine demodicosis. Demodex ingi can also cause disease and is often associated with a greasy seborrhea and lesions along the dorsal trunk. The short-bodied cornea-like form resides much closer to the stratum corneum and has been associated with dermatitis, although its status as a distinct species remains debated. Most canine demodicosis is not considered contagious. Puppies normally acquire Demodex from the dam during close contact shortly after birth, and clinical disease usually reflects abnormal mite proliferation related to host susceptibility. The possible exception is the short-bodied cornea-like form, which CAPC notes may be contagious. So direct transmission between dogs remains a consideration with that form. Clinically, think alopecia, erythema, scaling, comedones, follicular casts, and secondary pyoderma. Juvenile onset and adult onset disease should trigger very different clinical thinking. In an adult dog, especially one with generalized disease, investigate underlying illness, immunosuppression, or immune suppressive medication. Diagnosis depends on location. Demodex canis and Demodex ingi usually require a deep skin scrape or trichogram because they occupy follicles and sebaceous glands. Because the short-bodied cornea-like form is more superficial, a superficial skin scrape may be all that you need. The pattern is mite location determines diagnostic method. Deep forms require deep sampling, while the short-bodied superficial form may be found closer to the surface. In cats, separate two patterns. Demodex cati is more like the follicular Demodex pattern that we just discussed. It is a deeper mite associated with hair follicles and may be linked to underlying disease, immunosuppression, ceruminous otitis, or dermatitis around the head and neck. Diagnosis may involve deep skin scrape, trichogram, or ear debris depending on presentation. Demodex gatui is different. It is more superficial, pruritic, and contagious. Cats may overgroom, and because cats are tiny professionals at removing evidence, the mites may be hard to find. Negative samples do not rule it out. Superficial scraping, tape prep, fecal flotation in some contexts, and treating in-contact cats may all come into the diagnostic plan. The takeaway? Demodex cati is deep and follicular. Demodex gatui is superficial, itchy, and contagious. Clientiella is the classic walking dandruff mite. Dogs, cats, and rabbits can be affected, and the pattern to remember is dorsal scaling, mobile flakes, variable pruritus, and surface-dwelling mite that lives in keratin and along the hair coat. This is a mite of the surface, not a follicular mite like Demodex, and not one that burrows like Sarcoptes. That matters diagnostically because you go looking on the outside. Tape test, flea combing, coat brushing, or hairs carry mites or eggs. False negatives can happen, particularly in well-groomed animals. Clientiella also has a zoonotic itch potential. People may develop transient pruritic papules after exposure, but humans are incidental hosts, not the main host. Morphologically, the big clue is the prominent palpal claws. They give Clientiella a very distinctive look, almost like a tiny sci-fi villain built entirely out of hooks and bad intentions. So the pattern is dorsal scale plus walking dandruff plus tape test or flea comb. If the dandruff looks like it's trying to leave the patient on its own, Clientiella belongs on the list. Here is a comparison table for your reference. Notice the diagnostic method changes with lifestyle. Ear mite, ear swab. Burrowing mite, superficial scrape and patience. Follicular Demodex, deep scrape or trichogram. And surface mite, tape prep, flea comb, or coat brushing. This is why memorizing names alone is fragile. Patterns are more sturdy. Ask where the parasite lives, and the diagnostic method usually will start to reveal itself. Now we leave the dog and cat dermatology comfort zone and move into large animal, poultry, and exotic mites. Same diagnostic rule, new hosts, new favorite sites. Do not memorize mites as a list. Use the same pathway: host, site, lifestyle, diagnostic method. This is where feet, feathers, housing, skin folds, water bowls, cages, and the environment all become part of the diagnostic conversation. Coreoptes bovis is the feet and legs mange pattern. Think cattle, sheep, goats, other ruminants, and horses. It is a surface-dwelling mite, and the classic sites are distal limbs, pasterns, fetlocks, and lower legs. Depending on the host, lesions may also involve the tail base, udder, or scrotum. Clinical signs can be variable. You may see scaling, crusting, dermatitis, rubbing, and irritation, especially on feathered or chronically irritated lower limbs. Diagnosis is usually by superficial skin scrapings or tape preparation from scale and crust. The pattern is feet plus lower legs plus surface mite plus superficial sampling. Under the microscope, Coreoptes has a general look of a surface mite, with its broad body and legs that project beyond the body margin. In this image, the two round structures near the rear are not eyes. They are copulatory suckers, which indicate that this is a male mite. So when in doubt with Coreoptes, look down. The parasite is not trying to be mysterious. It has a leg theme. And even the microscope image rewards anyone paying attention to the back end. Coreoptes gives us the classic, intensely irritating surface mite pattern. The name comes from the Greek sora, meaning itch, mange, or scabby skin disease. The species name then points toward the traditional hosts. Ovis means sheep, so Coreoptes ovis is especially important in sheep, but can also affect cattle. Cuniculi refers to the rabbit, giving us the classic rabbit ear mite, Coreoptes cuniculi. These mites do not burrow like Sarcoptes. They remain on the skin surface, where feeding and the host's inflammatory response produce intense irritation and exudate. In sheep, think severe pruritus, rubbing, fleece loss, crusting, scab, scale, and exudative dermatitis. The mites stay superficial, but the clinical reaction is anything but superficial. In rabbits, think thick ear crusts, otitis externa, head shaking, and sometimes dramatic ear disease. Diagnosis uses superficial skin scraping or examination of active crusts and scabs. In rabbits, collect material from the ear debris and crust margins rather than simply admiring that impressive architecture. The pattern is severe plus crusting surface lesions plus sheepskin or rabbit ears plus superficial sampling. Nemidocoptes is one of the better etymology gifts in this lecture. The root nemid refers to a greave, the piece of armor that protects the leg, and coptine means to cut. So the genus name means cutting or breaking the greaves. Since bird legs often resemble greaves, and the mite often inhabits this location, the genus name is perfect. Clinically, think birds, especially pet and aviary birds with scaly legs, scaly face, beak margin lesions, and hyperkeratotic crusting. These are burrowing mites of birds, and severe cases can cause irritation, lameness, poor condition, beak or leg changes, and debilitation. Diagnosis is by skin scrape or crust examination from affected legs or face. With the caudal set of legs being shorter than its body, we can confirm that this is a burrowing mite. Now to poultry blood-feeding mites. The big teaching contrast is where you look. Dermonosis gallinae is the red poultry mite and is often an environmental, off-host, night-feeding mite. It hides in cracks, crevices, nests, perches, and housing, and then feeds on birds, often at night. Due to this mite lifestyle, it can be easy to miss the mite when examining the bird. Orthonisis species are more on-host. They are often easier to find directly on the bird, especially around the vent or cloacal feathers and plumage. Clinically, both of these mites cause irritation, restlessness, feather damage, dirty vent feathers, anemia, weakness, and reduced production in heavy infestations. Same problem, different search strategy. Ophionissus natrissus is one of my favorites because it creates a nearly perfect exotic animal teaching case. The root ophio means snake. You may recognize it from Ophiuchus, the snake bearer, a constellation crossed by the ecliptic and sometimes nicknamed the 13th zodiac constellation. Ophiuchus is traditionally associated with Asclepius, the Greek god of medicine and healing. His single snake wrapped around a staff gives us the rod of Asclepius, the traditional symbol of medicine used by organizations including the WHO and the AVMA. Do not confuse it with the winged two-snake caduceus of Hermes. Apparently, even medical symbolism can require a differential diagnosis. Clinically, this is a snake mite. Think captive snakes and other reptiles, especially around the eyes and nostrils, between scales, within skin folds, and near the cloaca. We can also see it along the ventral body. Remember to inspect the water bowl and enclosure because the environment is part of the patient. Affected snakes may rub, soak more frequently, shed poorly, or become lethargic, anemic, and debilitated with heavy infestations. Diagnosis means examining both the snake and its surroundings. Collect mites from the skin, water bowl, cage surfaces, skin sheds, and enclosure debris for tape preparation or direct microscopy. One memorable human health note comes from Mullen and Durden. Humans are unsuitable hosts. Snake mites may bite people and cause pruritic dermatitis, but after beginning to feed on human blood, they become immobile and fail to recover. No transmission of a human pathogen has been established. Bad day for the mite, itchy day for the human, but not a human life cycle. Chiggers are trombiculid larvae, and the word larva is a big clue. Only the larval stage is parasitic. That is the stage found on the patient. The nymphs and adults are free living in the environment. Because these are larvae, they have 3 pairs of legs for a total of 6. That helps separate them from the latter mite stages, which have 8 legs. Clinically, think seasonal outdoor exposure. These mites are often associated with warm weather, grasses, weeds, brush, leaf litter, or other ground contact environments. Dogs, cats, wildlife, livestock, and humans may all be affected. The larvae cluster on the skin surface, especially at contact sites such as feet, ears, ventrum, interdigital skin, and other areas that brush against the infected vegetation or soil. These lesions are often intensely pruritic. You may see small orange clustered larvae along the papules, erythema, crusting, and self-trauma. The pattern is seasonal exposure plus orange clustered larvae plus contact site distribution plus intense itch. If the patient came in from the outdoors and looks like it rolled through an itchy orange conspiracy, chiggers belong on that list. Now for the part that makes chiggers memorable, their feeding mechanism. Trombiculid larvae do not burrow deeply like Sarcoptes. They attach superficially and insert their mouthparts into the upper layers of the skin. As they feed, their saliva drips enzymes that digest host tissues. Those salivary secretions help create a stylostome, which is essentially a feeding tube formed within the skin. The larva then feeds through that tube on liquefied tissue products and tissue fluids, rather than taking a true blood meal. So the stylostome is one of the keys to understanding the lesions. Much of the itching and inflammation is caused by the combination of larval feeding, salivary enzymes, and the host inflammatory response. This also helps explain why lesions may persist even after the larva is gone. The patient may no longer have a visible chigger, but the stylostome and the host reaction can keep the site inflamed and pruritic. So remember, larval-only parasitism, superficial attachment, stylostome formation, liquefied tissue feeding, and intense pruritic papules. In short, the chigger does not tunnel in and drink blood. It sets up a tiny external feeding station and lets the skin become its smoothie. This table is the same message again. The host changes, the site changes, and the diagnostic method follows. For Coreoptes, think distal limbs. For Sauroptes, think surface crusts and sheepskin or rabbit ears. For Nemidocoptes, think bird legs and face. For Dermonissus, think environment and nighttime. For Ornithonissus, think bird-focused search. For Ophionissus, think snake plus enclosure. And for chiggers, think larva only and outdoor exposure. Same framework, different hosts. Now we make a taxonomic turn. The next organisms are not mites, but they still matter. They cause irritation, confuse diagnosis, set up public health conversations, or look like something that they are not. Do not force them into the mite box. Instead, keep asking the same clinical questions. What is it? Who does it affect? Where is it found? And how do we confirm it? This is the little parade of not mites, but still weird. Cymex species, the bedbugs, are insects. They are true bugs in the order Hemiptera, not mites. This means 6 legs, wingless flattened body, piercing sucking mouth parts, and blood-feeding behavior. The veterinary relevance is often environmental and public health related. Bedbugs like to hide in cracks, crevices, mattresses, furniture, kennels, shelters, transport crates, and resting areas. They emerge to feed, often at night. The host may be human, dog, cat, bird, or another warm-blooded animal. But the real infestation is in the environment. Clinical signs are usually pruritic papules or wheals, sometimes in clusters, with irritation and self-trauma. Diagnosis is by history, inspection, and finding live bugs, shed skins, eggs, fecal spots, or blood spots. Bottom line, manage the environment, not just the patient. Melophagus ovinus, the sheepked, belongs taxonomically within the flies. It is a wingless dipteran in the family Hippoboscidae, the louse flies or keds. It looks like a tick, acts like an ectoparasite, but it is a fly. Parasite identity theft at its finest. The name is wonderfully sheep-focused. Melophagus can be thought of as sheep-eater, and ovinus also points back to sheep. The parasite basically arrives already wearing wool. Adults live in the fleece close to the skin and feed on blood. They cause irritation, rubbing, wool damage, decreased fleece value, and sometimes anemia in heavy infestations. A key life cycle point. Sheepkeds are not laying eggs like a typical fly. Females produce mature larvae that quickly pupate in the fleece. So when you examine sheep, look in the wool close to the skin for adult keds and pupa. Take home, not a mite, not a tick, not a louse, it's a wingless fly. Pentostomes are called tongueworms, and they are a perfect closer because they are strange even by parasite standards. Despite their worm-like annulated bodies, they are not true worms. Modern evidence places them among the crustaceans. Think of them as lobsters that went fully parasitic and stopped caring whether anyone could recognize them. The name Pentastomida comes from penta meaning 5 and stoma meaning mouth. Early observers thought the center mouth and 4 surrounding hooks looked like 5 mouths. They do not actually have 5 mouths, but the name survived because taxonomy never lets a dramatic first impression go to waste. The basic life cycle is indirect. Adults live in the respiratory tract, nasal passages, sinuses, or lungs of the definitive host. Eggs are coughed up, swallowed, and exit in the feces and later ingested by an intermediate host. Larvae hatch, migrate to tissues, and develop into nymphal stages. The definitive host becomes infected by eating infected tissues. Some pentastome life cycles may involve more than one intermediate or paratenic host, so I would avoid making the exactly one intermediate host sound universal. For Linguatula serrata, think dogs and wild canids as definitive hosts. with adults in the nasal cavity and paranasal sinuses. Herbivorous mammals commonly serve as intermediate hosts. For Armoliphilar, think large snakes, especially pythons, as definitive hosts, with adults in the respiratory tract or lungs. Coiled nymphs develop in the viscera of mammalian intermediate or aberrant hosts, including people. In summary, a worm-like parasite, crustacean ancestry, respiratory adult, tissue nymph, and an infection through eating an infected host. Evolution looked at a lobster body plan and said, let's make this profoundly upsetting. Let's return to the rule: host, site, lifestyle, diagnostic method. Mites are easier when organized by where they live and how you find them. If you know the host, narrow the list. If you know the site, you can narrow it further. If you know the lifestyle, you know whether you should be thinking surface prep, deep scrape, ear swab, trichogram, combing, crust evaluation, or environmental sampling. Burrowing mites often need skin scraping. Surface mites are often found on the skin, scale, hair, or feathers. Follicular mites may need deeper sampling. Environmental cues matter for poultry mites, snake mites, and bed bugs. Do not start by trying to memorize every mite name. Start with the pattern, the parasite follows. Thanks for watching. I'm Christopher Lee, and what you know today protects everyone tomorrow.